Hey guys, it's Dr. Mike, and let's talk about something super important today: high blood pressure. We're talking about a condition that affects millions of people, often without them even realizing it. That's why it's called the silent killer. It sneaks up on you, and by the time you notice the symptoms, it might be too late. It can lurk in the background for years, quietly damaging your body without setting off any major alarms. There are subtle signs, whispers of trouble that most people simply ignore or mistake for something else. We're going to talk about those sneaky symptoms that might seem harmless on their own, but could be a sign of something much more serious. So stay tuned, because this information could save a life, maybe even your own. Let's talk about headaches. We've all had them, that dull throbbing, that feeling of pressure building up in your head. Most of the time it's nothing to worry about, but what if I told you that those headaches, especially if they're happening frequently, could be your body trying to tell you something's off? When your blood pressure is consistently high, it puts extra strain on your blood vessels, including those in your brain. Imagine a garden hose with too much water pressure. Eventually it's going to start bulging and stretching. Pay attention to the pattern. Are you waking up with a headache more often than not? Are your headaches becoming more intense or frequent? It could be your body's way of saying, hey, something's not right here, you need to get this checked out. Have you ever stood up too quickly and felt a little dizzy, like the room was spinning for a second? We've all been there. It's usually harmless, caused by a temporary drop in blood pressure when you change positions too fast. But what if that dizziness or lightheadedness becomes a regular occurrence? What if it happens even when you haven't jumped out of your chair? High blood pressure can mess with the blood flow to your brain. When it doesn't get enough blood flow, you can experience dizziness, lightheadedness, even fainting. If you find yourself feeling dizzy or lightheaded, especially if it happens frequently or for no apparent reason, don't ignore it. It's time to schedule a checkup with your doctor and get your blood pressure checked. Blurred vision and seeing spots, protecting your precious eyesight. Let's talk about your eyes for a second. They're pretty amazing, right? They allow you to see the world around you, to experience all the beauty and wonder life has to offer. But your eyes are also incredibly delicate, and they can be affected by high blood pressure in ways you might not expect. High blood pressure can damage the tiny blood vessels in your eyes, those delicate capillaries that supply your retina with oxygen and nutrients. Over time, this damage can lead to blurred vision, seeing spots or floaters, even double vision. If you're experiencing persistent vision problems, especially if they're accompanied by other symptoms we've talked about, like headaches or dizziness, it's crucial to get your blood pressure checked. Ignoring these warning signs could lead to a condition called hypertensive retinopathy, which can cause permanent vision loss. So protect your precious eyesight, pay attention to what your body's telling you, and get your blood pressure checked regularly. Shortness of breath. When breathing becomes a struggle, let's talk about something we all do without even thinking about it: breathing. But what if something as simple as walking up a flight of stairs or carrying groceries suddenly leaves you gasping for air? That's not normal, and it could be a sign that your heart is working overtime because of high blood pressure. High blood pressure makes your heart work harder to pump blood through your arteries, and over time this can weaken your heart muscle. If you're finding yourself struggling to catch your breath, even after minimal exertion, don't ignore it. Your body is sending you a clear message that something is wrong. Get your blood pressure checked, and let's make sure your heart is happy and healthy. Chest pain and irregular heartbeat urgent warning signs. We're talking about chest pain and irregular heartbeat, two of the most serious warning signs of high blood pressure that you should never, ever ignore. When I say chest pain, I'm not talking about a pulled muscle from hitting the gym too hard. I'm talking about a feeling of tightness, pressure, or a squeezing sensation in your chest. This kind of chest pain, especially when it spreads to your arms, neck, or jaw, is a major red flag and could indicate a heart attack. If you're experiencing any of these symptoms, especially if they come on suddenly or are severe, call 911 immediately. Every second counts when it comes to your heart health. Take action. Your health is in your hands. We've covered a lot of ground today, and I know it can be overwhelming, but the most important thing to remember is this: you are not powerless. You have the power to take control of your health starting today. High blood pressure is treatable. With the right lifestyle changes and medical care, you can lower your blood pressure, reduce your risk of complications, and live a long, healthy life. Don't wait for these silent warnings to become a full-blown crisis. Take action now.